Hello and welcome back to The Naked Truth. Thank you for joining us for the second episode of the special 5-episode series under the Transforming Lives program. Access to safe abortion is a human right and saving lives matters, focusing on examining the impact and the consequences of unsafe abortion as part of the SAFAID's flagship My Choice, Our Choice campaign, which is being supported by Sweden under the Regional Transforming Lives program. The campaign seeks to create or contribute towards a SADC region where adolescent girls and young women can access free from judgment, safe and legal abortion services, supported by policymakers, men and boys, as well as community leaders. Many countries have restrictive abortion laws, and in the SADC region, 14 of our countries are classified as being either highly restrictive or having moderately restrictive abortion laws. Today we are discussing what policymakers can do to ensure that we catalyze actions towards reviewing some of these policies to ensure that we safeguard the health and the well-being of adolescent girls and young women. Joining us today is Honorable Jasmine Tofa, who is a parliamentarian and a member of the Portfolio Committee on Health. Honorable Tofa is very passionate about issues of sexual and reproductive health and rights and women's rights, and has been actively using her position as a parliamentarian to champion and advocate for women and girls' access to sexual and reproductive health and rights, including addressing issues of unsafe abortion. Honorable Tofa, welcome to the Naked Truth Show.
Thank you for having me. I'm glad to be here.
Honorable Tofa, why do we still have unfriendly policies or restrictive policies, despite what the statistics or the reports say, as well as just looking at some of the commitments and the declarations that have been made at regional and global level?
Okay, there are various reasons why we have this unfriendly law still with us. And remember, before we change any law, there are processes that have to be followed in Parliament, and parliamentarians are the ones that actually drive this process. So what is important is having parliamentarians on board. And we have to remember that parliamentarians come from different backgrounds and have been socialized as such. Remembering the fact again that termination of pregnancies is a very sensitive issue. You can talk about it and in a social sense, it's sensitive, religious sense, it's sensitive, culturally, it's sensitive. So trying to bring the subject into Parliament was quite a problem. So we had to get people to understand that the reason we were advocating for this law was because it was affecting our communities, particularly young girls, young women, and older women. And also making members of Parliament see from the statistics in their communities how many people they were actually bearing in their communities that would have died from unsafe abortion, and trying to get them to see and understand the methods. But it didn't just work from us talking about it. We had to get members from Parliament to form a caucus group, people of like minds. And when I say people of like minds, the initial thing that drew us together was the fact that we realized what the challenge was. And the challenge being members of Parliament and the community looking at it as an introduction and bringing abortion in and giving everyone a blank check to have an abortion. So we needed to get parliamentarians and Parliament to understand that we were looking at those that will have abortion whether we like it or not. And because of the unsafe methods or the fact that abortion was not legal and was very restricted according to our constitution, and it restricted people, young girls and women, to only have an abortion if they were raped, if there was incest, and also if it threatened the health of the woman or the child. And we also find what is hindering the progress is that a lot of people in Zimbabwe don't know that abortion is actually legal. They think it's illegal. They don't know that it's very restrictive though. So that is what has taken us, or is taking us, a long time. It's not that we're not doing anything about it. We have progressed as parliamentarians. We've made inroads. Also, the introduction of SRHR across the portfolio committees has helped a lot. The introduction of SRHR has helped a lot of women parliamentarians to find issues to talk about, to even contribute in debate in Parliament. You found that women parliamentarians didn't understand what SRHR meant, sexual reproductive health rights. To them it was very intimidating, but once it was broken down and they understood that you're talking about, children's health, the health of the community, sexual activities of youth, and talking about pads and, pregnancies, rape, GBV, things like that, it became exciting because parliamentarians then found that they had something to talk about. And then we also had Men Champion come on board. So I think we are making headway, and a lot of parliamentarians are coming on board. There are some that are still very skeptical, but I think we're on course.
Mm-hmm. And thank you very much for that response, Honourable. So I'll just go back to some of the points that you were raising. For example, really unpacking the issues that we are facing. But are parliamentarians really fully aware of the threats that unsafe abortion or consequences of unsafe abortion have on the overall picture if we're looking at sustainable development, for example?
I would say some parliamentarians are aware of the impact that unsafe termination of pregnancy has on society, on communities, on the country, but not a lot of them. So we still, I believe that we need maybe some kind of interactions or workshops to make them have an appreciation of what impact termination of pregnancy actually has.
So besides just the workshops on building their capacity, what else can we do, to motivate more parliamentarians to speak about the issue or to find connections with the issue amongst the various sectors or development sectors that we have in the country and in the region?
Okay, there are quite a number of things. I think I could cite a few examples that actually motivated myself and a few of the other parliamentarians. It's very important for some people to have a first-hand experience and face reality of what is actually going on in and around us. For example, I think it was in the last parliament, could have been 2015, 2014, 2015, where Msasa Project invited us as parliamentarians to come to their place of business, if for lack of a better word, to the institution. And we were shown some very young girls from the age of 10 that were highly pregnant. And it was a number of parliamentarians, both female and male parliamentarians. And that's also very important to make sure that both, we have gender representation fighting the cause to help our women in Zimbabwe, because we do have male parliamentarians in constituencies. In fact, there are more than the women parliamentarians. So that gave, that shook a lot of members of parliament. They couldn't believe, because most of them for the first time were seeing young girls at the age of 10, 11, 13 being pregnant, actually, visibly pregnant. And most of them asked, but why didn't these young people, or why did they not get access to abortion? And the Msasa Project explained to us that the process of getting an abortion is quite cumbersome, stringent, it's long, because first of all, you have to report to the police. After you report to the police, you have to go to a hospital, and if you go to a hospital or a clinic, well, there has to be 2 doctors to attend to the patient or to the victim. And knowing the shortages of doctors that we have in Zimbabwe, it's very rare that you can find 2 doctors in one place. From there, they have to have the court process and so on. So it was quite educative and very informative, rather, for the members of parliament. And that for me should have been a point where we then pushed and, went full throttle to make sure that we improved the law on abortion. Unfortunately, at the time, and even now, you're finding that members of parliament are a bit skeptical to touch on the issue of talking about abortions in their community for fear of backlashes and repercussions. Yeah.
Mm-hmm. So we'll talk about more in depth about the fear of repercussions and backlashes, and how we can minimize that when we come back in the next segment.
Okay.
Join us for the second segment. Welcome back to the second segment. Today we're discussing restrictive abortion laws and what policymakers can do to make a change. Today we are joined by Honorable Jasmine Tofa, who's a member of parliament and a sexual and reproductive health and rights advocate. Honorable Tofa, welcome back to the second segment. So I know you had already started to talk about, the fear of backlash, for example. So my next question to you was going to be, where's the disconnection then between, some of the commitments that have been made at regional level, for example, the Maputo Protocol, the SADC SRH strategy, and also the commitments that some of our policymakers have made, and the actions on the ground. I know you'd already started to talk about it, but if you could elaborate a bit further for us.
I would think that the disconnection starts off, like I said earlier on, with regards to the processes. So if you look at our constitution, section 141 speaks to public engagement and participation. So it's important that the public are also educated. They need to understand and have an appreciation. And unless that is done, parliamentarians or policymakers will run into stumbling blocks. So that is where our issue is. And also, not only, and when we talk about the public and policymakers, we need to talk about community leaders, opinion makers, church leaders, or organizations and stuff like that. So that is where we need to bridge the gap, so that there is a common understanding in the fact that what we want to do is help the young girls and the women that are dying in our communities, or that are injuring themselves from using harmful practices to have or to terminate or to have abortions. Because, for instance, you'll find that people, because there is no facilities for safe abortion, and abortion is illegal in a sense because of the stringent restrictions, people will go underground and they will go to the older women that do these things, or they will help each other. They smash bottles that they put up their vaginas, and they use chilies, they use sticks, they use hangers. So you can imagine what happens. So we need to also make people realize, and also the fact that we need to make sure that our communities, instead of hiding the fact that this person has died of an abortion because they're afraid that people will talk about them. There's a stigma. There's your moral status in the community, and you'll find that as much as those church people talk about not having abortion not being Christian-like, but there are still those church people that have their children go have abortions, and even people in high income brackets go and have private abortions. And the poor are the ones that suffer the brunt. They will then go and see this go in the back street and have these abortions. And if that child is bleeding profusely or gets injured, she will keep quiet. She will not tell the parents. I mean, I've communicated with numerous members in the communities, and even countrywide when we've done our public hearings, where a young girl will be sick, and she'll say her head is sore, her feet are sore, and until it is too late, when maybe the parent goes in there and the child is almost dying, and there's a smell coming out of the room, then they rush the young girl to a hospital, and sometimes it's too late to save their lives. Or if you do save their lives, they cannot have children after that. But whereas if they had safe abortion, then they can have a good and better life and do what it is they wish to do in life.
Honorable Tofa, you're raising, the realities, and you're sharing with us the realities, the lived realities on the ground of a lot of adolescent girls and young women, and this is under what we'd call normal settings. So now with the COVID-19 pandemic, how has this affected the progress that had been made, for example, with the advocacy or even just access to services?
The COVID-19 situation, and in particular the lockdown, has had a serious adverse effect on the progress that was made by government, by NGOs, the SRHR community, because I wouldn't even say not a lot, no consideration was given when the lockdown was being done to the fact that women and girls need services that men don't need, for instance. Because you had to stay within your locality and location and could not go into town if you needed to go and get pads, for instance, if you needed to go and get contraceptives, you'd then be stuck at home. And also the violence that occurred in homes because of being stuck together. A lot of young girls were impregnated in the time of lockdown by family members because of the situation that they were in. So there was no way they could even go and report the cases. There was no way that even if one's child had been raped, for you to go to the police and you'd be stopped at roadblocks and so on and so forth. So it has had a huge impact at reversing the gains of progress that had been done.
Honorable Tofa, they're raising some very critical points for us to consider, especially when we're reflecting on the lived realities of a lot of adolescent girls and young women. Join us for the last segment after the break.
As political leaders and policymakers, it's our responsibility to do what's right for our citizens, to provide for their health and well-being, while also ensuring our countries prosper economically. Making abortion legal and accessible improves the lives of our communities by reducing maternal mortality and morbidity, keeping girls in school, and increasing sexual and reproductive health outcomes, and is also wise economic policy. That's because without access to safe abortion services, due to restrictive policies, unsafe abortions will happen. These are dangerous, even deadly, and are very costly. In fact, the cost of providing safe abortions is estimated to be less than 1/10 of the cost of caring for women after unsafe abortions. Loss of income and the potential costs of recovery can cause major financial burden to families, communities, and healthcare systems. Putting policies into place that expand access to safe abortion is a proven way to lower healthcare costs, reduce maternal deaths, and achieve sustainable development goals. Your country can save the lives of adolescent girls and young women by improving access to safe abortion through legal and policy change, in line with regional strategies and international development priorities. Learn more about how to save lives and unnecessary spending through improving access to reproductive health care at safaids.net. My choice, our choice.
Welcome back to the third and last segment. We are joined by Honorable Jasmine Tofa as we are discussing abortion policies, particularly the actions that members of parliament and other policymakers can take to address some of the restrictions that we have. Honorable Tofa, you made reference to some of the initiatives that we have that are already being done that focus on policymakers. But in your opinion, what is missing, or what can we do differently to ensure that we catalyze the actions of policymakers?
Okay, like I said earlier on, at the beginning of the conversation, is the fact that we need to make sure that members of parliament are in tune with what is going on and what termination of pregnancies actually entails. So we would look at possibly having more of our members of parliament workshopped to understand what termination of pregnancy is and how it actually affects their communities, so that we can, I think, in working with all the members of parliament, it would be good like to have statistics and almost like public hearings or outreaches in those communities for them to see what is taking place at the hospitals, at the clinics, and also having exchange programs with other countries to see what other countries have done and are doing. And it would also be good to have church leaders and community leaders that are of like minds, that understand what is going on, so that it takes away that fear that they may have that they'll be speaking against their religion or their culture. And also bringing cultural leaders together, including the senators in the Senate. We have chiefs in the Senate, and having those chiefs in the outreaches that we would have when we are meeting other chiefs. I know that we've had challenges in particular with the Senate, members of the Senate, because they are much older. They have issues with understanding and appreciating the issue of termination of pregnancies. But those that have come on board do now understand and appreciate that we will be doing policy not for us, but for the communities, and the fact that we are there to serve the people and look at the best interest of the girl child and the woman as inscribed in the Constitution.
Mm-hmm. And just lastly, what was your call to action to your fellow policymakers with regards to addressing restrictive abortion laws?
My call to fellow policymakers is let's realistically look at the current policy that is in place. We know that it is very restrictive, and we need to get it broadened with the understanding that we are looking to help those that have abortions, whether we like it or not. We know that for a fact that it's happening in the communities. We have lost lots of women, we've lost lots of young girls that had a very bright future ahead of them. In our universities, we've lost young girls, or young women, if you like. And some of us have actually lost daughters. We've lost mothers, we've lost sisters, we've lost very close relatives that we would like to be with us. Some members of the community and even parliamentarians are currently looking after orphans that were victims of unsafe abortion. So as legislators and members of parliament, let's look at getting the executive to broaden the law and being more flexible. For example, looking at the red tape that is there, for instance, what the woman has to go through to have that abortion. So we need, wherever there is red tape, for that to be cut down, for access to abortion to be made easier and more friendly. We also need to push as legislators for more education to the communities, awareness, appreciation, and understanding of processes of having abortions, educating the young girl or the woman not to wait until she's far gone. Because if we have SRHR taught in our communities, people will then know and understand where to go and when to go and how to go about things. So that is what I would say to my fellow legislators.
Thank you very much for joining us today, Honorable Tofa, and for that very strong call to action to your fellow policymakers.
No, thank you for having me here today on this very important topic. And it is also of paramount importance that our young girls and women get to make their choices, because it's their body, it's their lives, and let them have their future in their own hands. Thank you very much.
Thank you. Thank you very much for those parting words and the closing words. So today we're looking at how we can address restrictive abortion laws, particularly looking at reducing the incidence of maternal mortality and morbidity. Changing laws and removing restrictions will ensure that the lives of women and adolescent girls are not needlessly lost. This has been the Naked Truth Show. Access to safe abortion is a human right, and Saving Lives Matters series, brought to you by SAFAID in collaboration with Bayete Development Institute as part of the My Choice, Our Choice campaign, which is generously supported by Sweden under the Regional Transforming Lives program. Join us for the next episode as we continue to discuss this important issue. Goodbye.